I'm so excited to speak to Marissa Fayer today, who, in addition to being someone that I admire in the space for her contribution to business, to nonprofit, to investing, she's a friend and she is so amazingly clear about the benefit of her product and the company, which is not always the case when we speak to entrepreneurs.
I couldn't agree more. And this is such an incredibly common and concerning anxiety-provoking subject when we speak about breast cancer, missing breast cancer on traditional imaging, and talking about dense breasts. So maybe I'll just go into that very briefly. Breast tissue is made of fatty tissue and then also glandular and fibrous tissue. The latter two are considered dense breast tissue. And it's difficult to pick up cancers on mammograms when there's a large amount of this dense tissue because it becomes opaque on screen. And, you know, after all, we want this test to be as sensitive as possible. So she is really making a new mousetrap, a better mousetrap for this problem.
And one of the things that you and I talk about all the time is this is not meant to replace physicians. It's meant to give them tools so they can diagnose more accurately, they can treat the patients more efficiently, and ultimately all we ever care about is better health outcomes.
Absolutely. So let's talk to Marissa and hear what she has to say. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have our guest today, Marissa Fayer, who is a person who needs extra heads. She wears so many hats. She's the CEO of DeepLook Medical, the founder of HERhealthEQ, which is all about women's health equity. She's an investor. She's an advisor. She has 16 other jobs. I don't think we have a long enough time period to talk about them, but we are so excited to have you here today on Business of the V. Welcome.
Thanks for having me.
So, how do you spend your day? What do you spend most of your time on? Obviously, the big headline is women's health. What drives the interest, and then how do you make choices?
Most of my time right now is spent on DeepLook Medical. You know, I'm the CEO of a for-profit company, so that takes priority. HERhealthEQ will always be my big priority, considering it's women's health on a global scale. But it's a nonprofit, and unfortunately, until I become independently wealthy, I can't do that full time. I don't know. I'm an engineer, so I really like to color code my calendar, and I do about 6 things at once as well. None of them great, but at least 6 things. And yeah, I mean, listen, I'm always investing. I'm always looking at investments. I'm always, sitting on investment committee for a fund and working with another one. It's listen, we're women. We can do multiple things. It's not that hard. So yeah, and listen, who I'm talking to, the two of you are are literally the same.
Since you said DeepLook is the priority, and obviously your responsibility is to run a successful company and ultimately return money to your investors, tell us what DeepLook Medical is and what the company does.
Yeah, for sure. So it's a software technology company focused on imaging and oncology. We're already FDA cleared and cleared in the UK and Canada as well. And we can visualize, measure, and segment soft tumor lesions. And what makes us special is that we can see inside dense tissue, which means dense breasts, lung, liver, thyroid, all women's health problems. And nobody can actually visualize the real lesion. They can create, see a region of interest. They can't visualize it. We also have the specialty to be able to colorize it so that it actually creates something that's different visually for the radiologists. And it's the same every time. So it's deterministic, it's fixed. Obviously, we have new products coming out, but we're also cleared across the entire continuum of imaging. So mammography, ultrasound, CT, MRI, which is how we can get into all these other areas. We're not decision support yet, but we're helping provide more information for the radiologist to better determine, do they want to send the woman for a secondary screening? Do they want to send her for a third one, for a fourth one, for a fifth one? Do they want to send her for a biopsy? Because all of those things happen, especially in breast imaging. And a lot of the times, unfortunately, they're covering their asses. It's a CYA, and that's horrible. And the woman is suffering as a result, anxiety, and she's thinking she has cancer the whole time. And really, like, if they can see better, listen, on the ones where it's actually needed, for sure, send everyone for all the imaging. But when you don't need it, or you're just not sure, well, if you were able to, unintended, take a deeper look, then you'd be able to make a better decision to either send her or don't send her.
Yeah.
And it's just helping to get to a better, better standard of care, better visualization.
Oh my God, I have so many questions because this is my day-to-day bread and butter. So firstly, is this technology your invention, or is it something that you tweaked and have just been working on in terms of bringing it to market?
Yeah, I'm not the founder. Actually, we have 3 co-founders, all men, all not in healthcare.
Interesting.
I know, pick your jaw up from the ground. Like, it's for sure, like, that's the reaction always I get.
Well, refreshing.
They knew that they needed a woman CEO. They researched and sought me out. I actually joined the advisory board for like 2.5 years before I joined the company as CEO. And yeah, it's and honestly, the technology has now been passed on to our engineering team that I've brought on, who are GE executive, GE healthcare alum, and yeah, it's really interesting. It's a really interesting technology. We've adopted it, adapted it, and we've just gone commercial as in the last few months. So
interesting. Obviously not in big, huge practices yet, at least not in my neck of the woods, but I'm very interested to hear this coming around because there is, first of all, it's extraordinarily time consuming to explain to people over and over and over because so many people do have dense breasts. What exactly are dense breasts and why do we need to further pursue screening for enhanced sensitivity? But the big question always is, number one, is this going to replace a radiologist? Because these are conversations that are going on. And number two, is insurance going to cover it? Because my patients, and they are, well informed and bringing me New York Times articles on dense breasts, are not always willing to pay the extra bit for what they're not really understanding maybe, or what they think doesn't have enough value in terms of extra screening for dense breasts. Well,
good news. The patient for right now, for DL Precise, our first flagship product, the patient will never see a cost associated with this. It's actually a hospital kind of a workflow tool. The price point is so low that honestly, it would be like quarters of pennies for each patient as it gets amortized over everybody. So currently, no, not yet. In the future, as we create more, AI and machine learning and all of these, specialty reports and things like that, absolutely. But that's as you're further down the pathway anyway. So first and foremost, for now, there should be no patient costs associated with this unless we, 20x increase the price, not even 10,000x increase the price. And second question or second answer, no, this does not replace radiologists. And actually, we don't want to replace radiologists. We want them to have more information, to be more efficient, to provide better patient care, and to have the information and be sure when they're making a decision, they are sure that they've made the right decision because they can see. 45% of all women have dense breasts. It also disproportionately affects Black women, Asian women, and Jewish women. So the fact of the matter is, we're talking about 25% of the whole world has dense breasts.
Yeah.
Now, sure, it ranges from very dense to kind of dense and semi-dense and all of that, and isodense. But listen, like 25% of the whole world has a problem that you can't actually see. And now in the US, we're getting these like random letters to say you have dense breasts. We don't know if we saw everything. Well, wouldn't it just be nice to be like, actually, we do know that we saw everything because we could see inside your tissue. And so this is a tool that's like on demand when they need it. It's not automated. It's when they want to see it, when they want to use it. It's not running in the background. It's literally radiologist controlled, which means The radiologists still need to be there. And that's like the myth with AI that is going to replace radiologists. Listen, and you have to get first decision support. So first it's a visual tool, then it's decision support, and then it's diagnostic. But like nobody's gotten a diagnostic radiology claim yet to replace a radiologist. And like, that's not going to happen for years.
Well, that was my next question. So you say it's FDA cleared. Does that mean it's a validated test and
Yes.
it's reproducible year after year after year? So do we compare this technology this year and next year and we're able to pick up differences, or?
Yes, that's exactly. You can take all your priors and have them straight on the screen. And you can just run it, you know, click, 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 click. It's fixed code. It will never change over time. It will never change the result. The same mass will be the same mass. And that's the really interesting part. But yeah, you can take all your previous, like, listen, you can go back when they digitized film, you can even go back and do it. And we've tested this on other types of areas. Like we know it works in lung and liver, and thyroid, and also even like skin cancer lesions. Like even on a JPEG picture, it tangentially works. Like it's based on shape recognition, on pixels on the screen. It's not learning. It's
Fascinating.
not reading. And the other part is like with the radiologists, like it's important for them to be there. And the other thing is there's such a shortage day after day. There's more radiologists that are retiring and being pushed out versus coming into the practice. So there's going to be at least 100,000 radiologists around the world that are going to be missing from our healthcare system in the next few years. Well, the existing ones need tools to make them better, faster, and more efficient, to focus on the hard cases, focus on the dense breasts, focus on, the ones with high risk factors, focus on those women and be able to see. And so like, that's all we're doing.
It's so amazing. Every time we have a conversation, we all live and breathe in different aspects of women's health. When you hear these statistics and you still hear, menopause is a niche, even though 1 out of every 2 people walking on this planet is going to go through it. Are investors stunned when they hear that 25% of women have dense breasts, which would make it difficult to detect certain cancers?
25% of all women, 25% of all humans. So I still get the niche.
Say that again.
Whoa. So it's 45% of all women have dense breasts, which translates to about 25% of all humans walking around this earth. And considering the humans walking around the earth, are in more populated areas, who are both Black and Asian, it's actually, could be higher. And so yes, I get is this really a problem? But thankfully, listen, we talk about breast cancer. There's very few people, especially in the investor space, that don't know somebody who's had breast cancer, aren't affected by breast cancer. Like of all the cancers we're talking about, people know that this one exists. And the real question is, oh, well, there's so many tools. I'm like, yeah, there's a lot of tools, but none of them do this. So there's a lot of.
Well, you bring up an issue that we see over and over again as entrepreneurs with entrepreneurs, that you somehow have to validate it's real because someone in the room has to have some personal experience. And I always use the example, I could be making defense systems for cybersecurity for global military operations. I'm never going to use them, but certainly investors seem to understand that there's a market. So we're continuing to push on that and make progress. And I would say, do you have any data yet on the percentage that you're catching that historically might have been missed?
Or more importantly, the biopsy rate, because that's really where the dichotomy falls. So we push women for ultrasound, biopsy rate goes up. We push women for MRI, biopsy rate is off the charts. Where does this fall in that spectrum?
Well, maybe we should have recorded in a week, because on Friday I should have some data about the actual biopsy rate reduction, because we're finalizing some study data right now. But yeah, listen, this is an aid. We're already seeing a 25% reduction, between 15 and 25% reduction in needing to send somebody for a supplemental screen. And when we say supplemental screen, again, like there's multiple options. Like there's literally pathways, and you have 6 options before you hit the biopsy. And listen, there are times where it's like, nope, that is super obvious. You have to send them straight for biopsy. Great. We are not wanting to change that at all.
Yeah. And to your point that it affects, all people, there are more and more men getting diagnosed with breast cancer, especially with the advent of genetics testing. So this could really find a importance there as well.
Yeah. Well, then you look at lung cancer. I mean, everybody's walking around with nodules. It just depends if they've grown over time. And I just heard a quite interesting fact that actually lung cancer is growing fastest in non-smoker women than any other segment. So now, a lot of times, ironically, they're finding potential nodules on a mammogram and then sending them for a CT because now they have lung cancer. And so the thing with lung cancer is you have to measure them. Sometimes you can have up to 30 nodules, and then you have to compare them to last year's. And so now you need to physically measure every single one. And did you do it in the morning? Did you do it at night? Are you tired? Have your eyes been great? Now you can just click, 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 compare it to the other clicks that you can do again. And by the way, you're trusting yourself because most doctors don't trust somebody else, especially, with a measurement. So they have to redo it. So now we've just saved time. So, again, when we go into lung cancer, like this is a thing, thyroid affects 90%. And I think, Dr. Dweck, this best probably, like thyroid affects 90 to 95% women.
Yeah,
I mean, myself
absolutely.
included, so it's a women's health thing. So like other, liver cancer, the metastatic journey is from breast to liver. I mean, it's all connected. So, they're all dense tissue and they're all occluded by, we got ribs in there, we got other organs in there, and you can't see a lot of the time. So
here's today's hot flash. About 50% of breast cancers in dense breasts are actually missed on mammogram.
You talked about commercialization. We have lots of folks who have gotten to that point, many who didn't. Talk about that process and what that means and where your first markets and buyers were.
Yeah, so we've just gone commercial, and the way we were doing it is, as a small software company, it's really hard to get into hospital systems because there's also very few independent, radiology centers as well. So they're all systems. So what we've done is we've gone through the channel partnership where we're partnering with very large companies who already are direct selling into the hospital system. So for example, we partner with Barco, who makes 90% of all medical monitor imaging for the monitors, like what you view the images on, specifically 90% for all mammography and 80% for everything else. They are the market leader. They're a $2 billion company. They already have the contracts. They are already in the hospital systems. They finished cybersecurity. They finished HIPAA testing. They
so
are
you become a complement and added benefit?
We're an added benefit to them. So we're actually the first software technology adapted into their monitor so that you just click it and it's right there. You have to activate it. Obviously, that's how we get paid. But so that's how we've gone commercial. We've also partnered with Tempus, $8 billion AI company that's doing a lot of work specifically in precision medicine, also in rhesus testing, which is in clinical trials. They're enrolling clinical trials now. The biggest part of oncology clinical trials is to measure if your drug has worked or not, which means growth or non-growth. You need a very fixed, deterministic software that can measure without 3 radiologists arguing over which measurement they want to take. It's a time saver. So we've partnered with them to be integrated directly into their software. Now, sometimes we're private labeled, like with Tempus. Sometimes we're, brand labeled, such as with Barco. And we're looking at other partnerships as well. And so that's how we've gone commercial. We're currently being utilized in a New York based health system, and we've just gone commercial. So the sales teams for these companies are all deployed, and I'm waiting for the emails. I check and refresh all the time. This is the hardest part. I don't know, this makes me the most anxious because it's out of my control, which is a little unfortunate, but
it's certainly a much more capital efficient model than building your own sales force.
Yeah.
So
and
for
faster.
Listening who are, you said you're a small software company, you're partnering with multi-billion-dollar companies. What's the secret? Is there one? Those are 2 partnerships that will make or break the success of the way DeepLook Medical is going to market. What tips do you have on that?
Consider them part of your actual company and give them whatever information that they need, help them along. We have to do a little bit more lifting right now, especially marketing and, giving them materials and doing things that probably I would rely on them for. But you know what? We need them to sell. And we need to empower them and give them the information until they feel comfortable to do that. So, you know, as much as I don't love the hand holding a little bit, I want to make sure that they feel good, have the right information to get this into people's hands. Because listen, we're not going to change lives and improve women's health if it's just a great innovation that goes nowhere. And that's kind of one of the things that I wanted to make sure that we you know, like using the scale of these companies to grow.
Speaking partners, I mean, you're doing a lot of research, obviously, and this is time consuming. I mean, the studies probably take years and years because after all, there are so many slow growing tumors.
Yeah.
You know, how do you account for that? And what partners are you using to study this stuff?
Yeah, so I mean, with Tempest, it's at, you know, they're doing fast kind of, you know, they've rolled it out and we get paid obviously per click and, you know, something like that on that model. So that helps us generate some revenue. You know, annually we're working with Barco, so it's annual licenses and things like that. So, I mean, listen, this is why we need a lot of different partners. And this is why we have to bring them up and help them kind of scale their products in this area. So it's, yeah, it's a lot. That's all I have to say.
Before we let you go and do your 7 other jobs, spend a moment on HERhealthEQ, what it is, what it does, and what made you want to do this, in addition to the other things that you're focused on.
Yeah, I started HERhealthEQ, oh my God, 9-10 years ago, and it came out of an idea 20 years ago. But it is a global nonprofit focused on women's health in developing countries. And what we do is we deploy medical equipment that focuses on women's health NCDs. So breast cancer, cervical cancer, heart disease, and maternal health. A lot of the times there's a lot of equipment that in our fancy, ridiculous hospitals every 2 years gets swapped out, but an ultrasound has a useful life of 25 years. So nobody cares in general, and especially around the world, if there happens to be a little scratch on the base of the ultrasound. So what we do is, obviously we recertify, we repurpose, and we send the equipment with a service contract to make sure it's still working many, many years in advance, or, you know, in the future, with training manuals, logistics we take care of, and we get it to where it's needed. We do not set up our own clinics. We do not set up our own practices. There are tons of practices and clinics and doctors around the world that are perfectly trained, but they lack the equipment to do their job. And until women everywhere have access to quality healthcare and quality equipment, we are not in an equal world. And so that's very much what we do. And yeah, we always look for partners and donors and everybody. But it started because I developed the 3D mammography system with Hologic when I was working there. And the 2D systems were coming back and they were lined up against the wall and they were perfectly fine. And they were being scavenged for parts, even though when I was living in Costa Rica working for the company, women were dying of breast cancer because their mammography machine broke down. That's not fair. It's not just. And we can just repurpose equipment to get it to where it needs. And so that's what we do.
Well, luckily for that, we like to, you know, always have new shiny objects. So we will send the less shiny ones, hopefully your way.
Exactly. And we make them very shiny to make sure that they're attractive. You know, nobody cares that you change, you know, somebody changes a brand color from blue to green. Nobody cares except the marketing team at that company.
Well, I can say, I think for both of us that we're so happy to have you on this team of people trying to move women's health forward. It's really pretty remarkable to think about the impact of the work that you're doing. So thank you for taking your time today and thank you for all the work you do.
Thank you. So great speaking to both of you, and I'm just honored to be in your company.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.